You're welcome back. Right now on the conversation, our focus will be on the outbreak of monkeypox in some part of the world. Africa and Nigeria, of course, they are not left out of that outbreak of monkeypox. And on the 14th of August, 2024, the WHO World Health Organization actually declared monkeypox a public health emergency. What are the essential things that we need to know about monkeypox? What are the symptoms, and what are those precautionary measures that we need to put in place as we continue to fight this particular viral infection in Nigeria as well? Joining us this morning to educate us is Dr. Samuel Akingbe. He is the former National President, Environmental Health Officers Association of Nigeria. It's a pleasure to have you.
Good morning. Good morning, Lagos.
All right. Like I did say during my introduction, the WHO on the 14th of August declared monkeypox a public health emergency globally. I think the best way to start right now is for you to start by educating us on what essentially monkeypox is all about.
Oh, okay. Once again, good morning, and thank you for the opportunity to educate the populace in Nigeria and specifically Lagos State. So there will be enough enlightenment to keep them abreast of information and to prevent this further spread of the virus. Monkeypox is a disease that is caused by monkeypox virus. It's a special virus that is that belongs to the family of orthopox virus. It's actually similar to smallpox, but just that it's less severe, and it's the incubation period because it's 7 to 14 days, and it can be prevented seriously, and just to make sure that the people are enlightened and to get all that needs to be done in place. Monkeypox, like we said, is infectious, is communicable, can be transmitted from man to man, and also animal to man. In a way, it's zoonotic in nature and can be prevented. That's it.
Okay, so when you say man to man, how does he affect? As you mean, I live in an environment now where somebody is infected with monkeypox. What are the chances that I'm likely to contract it as well?
Oh, well, the chances, if there is an infected person in your environment, in your community, or within your living space, is very, very high, in the sense that it's depending on the contact with the infected person or with the infected animal, also with the material used by an infected person. If you are in an environment or in an enclosure where an infected person is, body contact, sexual contact, exchange of body fluid through kisses and all that can actually lead to the contracting of this infection. And also, if you come in contact with the body fluid of an infected animal, the body fluid or any bruises that can come as a matter of the claws, bruising by the claws, biting and all that, definitely one can come in contact with that. And if you are close to the person that is infected, the best is to take precautionary measures and take prophylactic measures to make sure that you are on top to be not to be infected. The materials, like I said, the beddings, utensils, surfaces that have been used or the person that is infected has come in contact with, is very dangerous also to use such without having cleansed and disinfect such surfaces. So it is.
Okay, before we talk more about the beddings, the clothing, and the surfaces that we need to be careful about, is it so alarming enough, this mpox now, that the WHO had to declare it a public health emergency?
Yeah, in some regions it's alarming, though we've not felt this new edition, this new episode so much in Nigeria. But it is good that we see it from afar and prevention is better and less expensive than cure, in the sense that if things travel because of human, movement, transportation,
And
interactions is so high globally. So you cannot actually say this is the time it's going to come into your environment. The best is to prevent it. Communicable disease can be as fast as it can be. So that is the reason when WHO declares it's a public health emergency of public health importance, we need to be aware and to be at alert to make sure that we are ready to take every precautionary measures to make sure we're on top of it here.
Okay, you mentioned animals the other time. Would you be more specific about those animals that we need to be careful about at this particular time? Because we eat all sorts of things in this part of the world.
We have animals that escape from the bush into man environment. That's interclimatic condition drift of animals from the bush into the environment. And those are also from domestic animals, as we call them. We have monkeys, we have even rats, we have dogs, we have those animals that are within man, that find themselves within man's environment. Once they are infected, they are capable of also transmitting to you. Yeah.
How about chicken?
Yeah. All the animals that you find within man's environment, they have affinity, animal to animal, then animal to man, then man invariably to man. It all depends on. It's dependent on those animals that you come in contact with, by which you can have body fluid exchange. Body fluid, they have contact with you, they play with you. Some of them will play with you and they scratch you. They deposit the virus into your body and then it begins to grow from there. And the worst is man to man may not even show immediately. There are some people, they might be symptomatic, some will be asymptomatic. They don't show signs and clinical features. But even when they are not showing it, they are capable of transmitting this particular virus. The more reason why we have to avoid congestion, overcrowding.
Okay.
You don't go too much around this. At this time, you don't go too much into where people are so clustered in a very small space, and you have to breathe into one another. You have to, even some respiratory droplets. Some people sneeze. When they sneeze, a lot of it is released, and you're catching it. So the cough or the reflex actions that may lead to release of droplets. Sorry?
You just say cough.
Yeah. When you cough, when you sneeze, when you release, even perspiration can carry it. Body wound, body touches,
sweat,
blood can lead to. So that is avenues by which you can actually spread or contact Mpox.
Okay, we are approaching the peak period of the rainy season now. Are we going to be at any risk?
That is going to be an advantage because during the rainy season, the weather is not dry, so flow of droplets is reduced.
Okay.
That is the flight of droplets is reduced. Definitely, that's going to reduce. But then, when you are in close contact, like I said, with an infected person, objects, or animal, definitely, one is at risk of getting this Mpox. That is the reason why we have to avoid it as much as well. Be it rain, dry, sun or shine, or we have to actually be able to limit contact with people. And then we are fond of running hands on surfaces, railings, walls, because especially children, on tables, on surfaces that you're not sure of the hygienic condition. You have to actually try to avoid it or limit it. And wherever they have to be vigilant now, because you see someone that comes down with pains.
I was going to ask you that. So what are those, before I take you to Joy, what are those vital signs and symptoms that will let me know that, okay, this might likely be Mpox?
Mpox come with the clinical features or ordinary, signs of fever, rashes, muscular pains, back pains, elevated or inflamed, we call it joints, where you have lymph nodes. Those lymph nodes will be inflamed. Those are signs of the Mpox. And the rashes you first of all see will be reddish in nature, flat red. Within few days, excuse me, within few days they begin to raise. They are elevated a little, and then another few days it begins to develop pus in it. And when it gets to about 7 to 2 weeks, 7 to 14 days, those pulses begin to come down and disappear.
Okay. So Joy has a question.
You said something that animals are also carriers of this virus. So I am not a lover of pets, but for those who have pets in their house, you find a lot of people, they have monkeys as pets, dogs and all sorts. How is it possible for them to know if their animals are carriers of this virus?
Well, the animal also, like man, will come down with fever.
Okay.
It's shown in them. They will come with fever. They come with chilling. They come with they lose appetite. They've come down sick. When any sick animal at this time, you have to be suspicious of it. And also we have to be meticulous to be observant of the vaccines that your animals are supposed to have. Your domestic animals, you must be up to date with the vaccinations. As well, when you see in an environment where someone is coming in contact with it, or you've just seen someone that has Mpox, or you come into the personal areas, or someone that was infected, you need to also go for the vaccine. There is vaccine. This is the same vaccine they use for smallpox that is used for Mpox. So you can approach the health facilities to make sure this is done. And then for your animals, take them to the vets, your veterinary doctors, to take care of them.
Okay, so for those surface and railings, like you rightly mentioned, are you suggesting now that we might need to go back to those days of COVID where we have to wash our hands from time to time, make use of hand sanitizers, and so on and so forth? Number one emphasis I'm going to lay is on decontamination. In every area that you suspect or you've moved an infected person, make sure you call on the environmental health officers to disinfect all the properties, all the surfaces there, including the ceiling, the bed, the floor, the walls, and all surfaces, the tables and what have you. And then let us also imbibe. It shouldn't be only during COVID. The habit of hand washing is very, very important. Disease in, disease out. Washing of hand is a very, very veritable, very potent process of preventing diseases. You make sure personal hygiene is heightened. Make sure you wash your, all your area, make them clean. Make sure the animals also have access to your living areas. You make sure your nails are well cut. You make sure that you wash your hand in and out of any activities, especially when you go to the toilet, you come back. When you run any activity, when you do any sanitation work, make sure you wash your hand properly under running water with soap. And let our children also imbibe this, because the children are prone to eat a lot. I was going to ask that, who are those at high risk?
Everyone is at high risk. Mostly children.
And they're on holiday now?
Yes. Some studies have shown that male are more prone, but there is no
scientific
evidence about that. It is likened to homosexuals. That they, but it is not as if that is the norm, that is the focus. Because those that do not belong to this class of individuals, they still have it. They still have it. So everyone is at risk, both old and young. Well, I can say because the children, because they go on the floor a lot, their coping device of running hand here and there is also a lot, and their own body immunity also is not as high as that of a mature man. That is our state. But everyone is at risk of Mpox, and we have to be vigilant.
So no doubt about it, we must also be conscious of our environment. What are those measures we also need to put in place that will be very effective as regards taking care of our environment?
Like I was saying, keep animals in their place.
Because we spread our clothes outside a lot here.
Keep animals in their place. If you have animals that are caged, let them be caged. This time is not when you play too long or too loosely and closely with animals, because their bite or the claws scratch on you might be dangerous. The first episode of Mpox in Nigeria in 1971, there was no sign of contact with any animal with the small girl that came down with it. So a few days after was when the mother also picked it. That was in 1971. There was no sign of play or imported case or whatever. It just came. So any object you can suspect. So personal hygiene, environmental sanitation is very, very key in the prevention of any disease, including this Mpox. And so when you have a suspected case, or move the person immediately. Someone has come down with fever, having waist pain, having
back pain,
inflammation on the lymph nodes, back pains, muscular pains, rashes. Please let the person go immediately to the to health facility. And once that is done, the environment must be disinfected immediately, and everyone must be made clean. Those that are close, that may have slept with that person, may have had body contact with that person, should also go to be vaccinated, so that you nip it in the bud. This enlightenment is very, very key, and everyone has to be, vigilant to prevent the spread of Mpox, like, contrary to what we've had before.
Okay, so for those who are running hotels and event centers, what say you to them at this particular time?
We have to be very, very careful. Those set of business needs a very close relationship with the environmental health officers. When they suspect anything, they have to be, to raise alarm. And again, the spaces that are used should be, the number of persons should be limited. No event center should be allowed to be to full capacity at this point in time. They should create distance. Social distancing should be, adopted, and regular disinfection of their places. In fact, disinfection is not high hardened stuff. It's not something that is difficult or that is that so expensive. Once you have events, at this point in time, you need to disinfect immediately before another event, so that you keep the place up and doing certified for use.
And hotels will also need to be.
And hotels, so their beddings. Once they have an inmate and they suspect anything, that particular room should be sealed up for that time. Invite environmental health officers to disinfect and make the place good before another occupant come in.
Okay, we know we are very proactive here in Lagos. So you mentioned sanitation the other time. What are you doing at the state level? Fine is not here yet, but we must think ahead before it gets here. What are those things you are doing in terms of engagement, especially for those at the grassroots?
Okay, I want to let you know that Lagos is very proactive, like you said, and the government of Lagos State is not leaving any stone unturned. Environmental health officers have been alerted, and they have been given, of course they have it as mandate, to intensify premises inspection. That's house-to-house inspection for detection of nuisances, to profile solutions to them, evolve ways to abate nuisances that might be, lead to spread or outbreak of diseases, and to prevent it in the world. We do that also by visiting every premises, food houses, industrial places, garden, like you mentioned, event places, hospitals, hotels, every area where people gather. every center where people are attracted on a daily basis. And you know the population in Lagos is so high. So we intensify all this. And also the pest control, the rodent and pest control unit of the Environmental Services Department of all the local governments have also been well equipped to make sure that this is tackled immediately. You would have been seeing some disinfection going on. Yeah, especially in public places, schools. We have close collaboration with the current Commissioner of Education, Basic Education, Honorable Jamiu Ali Balogun. He's been also carrying the crusade to the school, and he gave us access to the schools for disinfection wherever we find anything like that. And the Commissioner, as well as the SC, with the Government on Environment, they also are being very, very proactive in this, and we have meetings regularly to give updates wherever there's an issue. We immediately escalate it to relevant quarters, and they are taken up.
How about our markets? They are equally a public place, and people gather there a lot.
Yeah, you know, the market women and men, we have relationships with them, just to put them on red alert, because it's actually difficult to reduce the number of entrants into the market. The only thing we do is to put the market women and women on alert, to be vigilant, and to raise alarm immediately they see anything like that. Also, the pest control and disinfection that I talked about is extended to markets also. Yeah, and the weekly market sanitation exercise is
number one.
Is number one. It's key. Yeah, and we don't joke with it.
Okay. In spite of all these measures, my worry now is the fact that we know the porosity of our borders, and people don't only come into Nigeria through the airport, they're coming through our borders well. Yeah. How do we prevent, or how do we manage these borders in such a way that we won't be surprised?
As porous as our borders can be, we have environmental health officers in this my uniform at the land borders.
Really?
Yeah. They check the health status of whoever is coming in. Yes. Maybe for other reasons, for other, other stuff, maybe smuggling or whatever, maybe it can be porous. But for whoever is coming, even on our land borders, I was there like 3 weeks ago, and I saw what's going on. They first of all check your yellow card, which is the international certificate of your health status. They check it, and they look at you as they're checking that. So you must pass through them. We have them also at the seaport. We have them at the airport, but so everywhere environmental officers are there, and records are being, transmitted to relevant quarters as to whatever we find. So once anyone will find suspicious of, a carrier of any disease, it is alerted to the IDH. And a standing ambulance takes them to isolation, and we.
But I'm yet to start seeing those common things that we saw during the time of COVID-19, and that now we are fighting a double barrel kind of thing. Cholera is still there, and of course this Mpox, washing of hands, they're not so visible, and of course the use of sanitizers in public places.
Oh, well, maybe some. Because we made it a point of duty to ensure that that thing is not eliminated, or they do not phase it out. We know how very important it is to keep, washing hands. If any woman comes into any of our facilities for maybe prenatal, antenatal, or something like that, you will see them being taught as to hand washing. And on the entrance of each of these places you're talking about, you will still see them there. What we make sure we do is to make sure that they are serviceable, that they are working. Hotels cannot but have hand washing, equipment, facility.
Not all.
Yeah, may not be all. That's what I said. Maybe not all, but those that does not have, we are still, on. Our routine inspection still detects, and we insist they should have it. And that's
okay. The treatment for these Mpox, is it readily available? No, do we have vaccine?
Well, there's vaccine, but there's no treatment. The only thing is just to manage the case as it will present. The features that it comes with, depending on the individual, is what has been treated. But it's not that fatality is very, very low. Very, very low, and within 1 to 2 weeks, the pox is, they fizzle out, and then the person is okay.
So what kind of feedback are you getting from your colleagues? I'm aware that Mpox is already in some part of the country.
Yeah.
What kind of collaboration are you having, and what kind of feedback are you getting from them?
Well, like I said, we relate on a regular basis. We have a particular platform where each state reports on environmental health approach to Mpox prevention. So that we are working through, and we have also collaboration. Also, we have our officers in NCDC, and we relate on a regular basis with this. So we are, we create even a desk table in some ministries where reports can be done. Minister of Environment, Minister of Health, they will have it there, and our officers are everywhere. Even in Lagos State, we have them, the Minister of Health, or the Minister of Environment, Minister of Local Government and Community, in case there's anything. So the desk is open for people to report, and all the 20 and 37 LG and SCDs, we have the department there ready to receive any complaint, and we have direct approach and to all the primary healthcare centers where this can immediately be taken up.
Okay, so those symptoms that you identified earlier, for anybody who might be so observant to have seen those symptoms, what should be the first step that they would take?
The first is to move the person to the nearest health facility. That is the next thing. You have to be even watchful of someone that was active yesterday is less active today. Try and watch what is wrong with the person. Try and check, maybe from a distance, to check what's on the skin of the person. Check what complaints he has. Then advise the person or help in moving the person with yourself being protected. Protect yourself to prevent you contacting it to the health facility.
How do I protect myself? Do I need to wear gloves? What are the basic things that I need to do?
You see, because you are an individual that is not a public health professional, you may not be prepared for it. But immediately you help to move the person. How do you do that? Create a distance. You may not have that in your house to have gloves. So create a distance. Just help the person to get into a vehicle. Take the person to the facility, and when you are done, disinfect the vehicle. You also approach the facility for vaccination, so that you are protected. And then wherever the health professionals this time around, we always insist that they observe the SOPs.
What was the SOP?
Standard operating procedure.
Okay, take us
and
through
it involves wearing PPEs. Personal protective equipment, the head covering, the nose covering, the gloves, the apron, and all the wares that needs to be taken before attending to any emergency. So that has to be taken, and immediately after, get yourself disinfected before leaving your post. That is the SOP.
Okay, I think you need to repeat those symptoms again so that those who might not have started the program with us will hear it again from you directly, so that when they see such in their communities, in their churches, in their mosque, in their place of work, they will be able to raise the alarm.
Okay, before I go to that, sorry, because you mentioned religious places, I just want to sound this, that our imams, pastors, GOs, evangelists, or as we have it, should please create distance, social distance at this time, within their auditorium, within their workplaces, so that people do not breathe into one another, people do not sneeze into one another, they don't cough into one another, and to make sure they create that distance. Secondly, they must also make sure they invite EHOs to come disinfect their environment.
Environmental health
officers to come disinfect or decontamination, as you want to mention, call it, their environment, their premises on a regular basis. It's not out of place. It won't be out of place if churches, large churches, will have the health unit that can readily pick up a knapsack sprayer and mix up. If they need to be trained, they can come up to the local government. We give them simple scientific information as to how to operate it, to disinfect after its volume service. There are some churches that gather up to 10,000 people at a time, 7,000, 5,000, even 100. depending on the size of the place. You can disinfect just the walls, the floor, and then the area treatment then makes the place, you are sure that your place is, you're okay. And once anybody, you notice anybody that have, that's coming out down with fever, that has rashes, I'm mentioning the features now.
Okay.
That has fever, headache, rashes on the body, inflamed lymph nodes. These are on the armpit, you have them some, the neck side, you have them some, the waist side. There are points where we have lymph nodes in the body. The lymph node will be swollen. So all such signs, you should please advise the person to approach the nearest health facility and alert the local government also immediately. So we can do what we call contact tracing. Those that have been in contact with the person, to trace them and observe, put some people on surveillance to be sure that they are good. Those that needed to be, vaccinated will be taken up as such.
So this is not the best time to take bushmeat, and some people in some part of Nigeria they eat dog. It's not the best time to take in such.
You can just make sure they are thoroughly cooked.
You take dog?
Thoroughly cooked. Dog is an edible animal. If you can eat monkey, if you can eat goat, what's different from dog? So we in public health, we're not going to be saying this animal is not edible. It is edible. It is muscle that you eat in goat, in ram, in cow, isn't it? So the same thing, dog has its own. Fish has its own. So whatever you are eating as animal, please cook thoroughly.
Okay.
Cook thoroughly. When you eat suya, make sure the suya is cooked thoroughly. Some people
since the outbreak of cholera, I've stopped suya.
But whatever you do, please make sure you cook them very well. Cook very well. Even food stuff in the house. Fruits. Yeah, wash your fruits. If you are not too sure, you can put a little salt in your water and wash your fruit before eating. But if that is fruit that you are going to peel off, you're fine. You can go.
All right, we must thank you very much, Dr. Samuel Akingbenyi, former National President, Environmental Health Officers Association of Nigeria. He's been taking us through monkeypox, which was declared Mpox now, a global public health emergency by WHO on the 14th of August. The symptoms that we need to look out for, the precautionary measures that we need to put in place, and of course, how we must support the government of the day in ensuring that some of the activities that the state government is using to minimize the spread of this monkeypox are effective in our places of worship, hotels, event centers, like he highlighted. Health, like we know, is wealth. We thank you for your time and for educating us on the program this morning.
Thank you very much. Thank you.
All right, we'll take a very quick break. When we come back, it will be the time for the Lagos State ladies to take you through what is happening right here in the Center of Excellence. We'll be right back.